is Kassandra Romas, and welcome to 30 Medical Minutes. Our topic today on 30 Medical Minutes is something that many of us can relate to, not quite feeling like ourselves and not knowing what to do about it. When it seems that you have your health, but you don't feel like you used to, when you know that things are not quite right, well, this is the program for you. Today, Dr. Lorraine Maita, an internist affiliated with Overlook Medical Center in Summit, New Jersey, will discuss feeling better from the inside out. Dr. Maida is going to describe how she approaches a patient's concern about feeling fat, fuzzy, flabby, and fatigued. She's going to discuss how nutrition, hormones, sleep, and exercise can be utilized to make all the difference in one's quality of life. This is a program for all of us to pay attention to. So stay tuned to learn about this really significant approach to your personal health. And now, let's welcome Dr. Maida to 30 Medical Minutes. Welcome, Dr. Maida. Thank you so much for joining me today.
Well, thank you so much for having me, Kassandra, because I love to educate people. I love to see them transform and feel so much better.
Oh, well, that's fantastic, and I'm sure our audience will really appreciate that. Before we get started on our topic, can you tell us a little bit about yourself and your practice?
Well, my practice is very different from a traditional doctor's practice because I really spend a lot of time with my patients. I listen to my patients. I get to the root cause of what's ailing them. Yes, I'm trained in internal medicine. I'm board certified in that. And I've also studied anti-aging medicine, functional medicine, integrative medicine. And I have a lot of tools in my toolbox to bring things together to find a systems-oriented approach to get at what's ailing people. So I don't cover up the symptom with a medication, I get to the root cause.
Wow, that is really amazing because as you say, you're a trained internist, but your approach is unique, it seems to me. And as you say, you're going to make people feel better from the inside out. So as I said in the introduction, people know they have their general health, but they're not quite themselves. They know that there's something not quite right. So when should somebody come and seek your help?
Exactly when they're not feeling quite right. They'll say something is wrong. They'll go to the doctor and the doctor said, you're normal. Or you're stressed, here, take this medication. Or, oh, you're just getting old. You know, nobody wants to hear that.
Yeah, that's for sure.
It's very disheartening because people feel hopeless and helpless, but that isn't the way it has to be. People really can be empowered to change their lives. They all come to me saying, you know, I just don't feel like myself. And that's why I came up with, why do they come to see me? They're feeling fat, flabby, flaky, foggy, fatigued, forgetful, maybe even a little bit frumpy. You know, their sex life isn't as good as it used to be. They don't have the energy and stamina. Maybe their doctor wants to put them on medication they don't want to go on, or they're on many medications and they want to get off the medications. So anybody who's looking to improve their health, energy, stamina, clarity, would benefit from a consultation.
So let's repeat this. Somebody has gone to their doctor, they've had all the tests, the blood tests and everything like that, and their chemical tests come out that they're within average normal range. And so they know something is not quite right. Maybe they feel like they're becoming hypochondriacs or something because, you know, there's that something that bothers them. So they shouldn't dismiss this at all. They should follow up on regaining their energy, regaining their let's say acuity for life, and not to be ashamed about saying, I don't feel quite right. I think I'm going to look further. And that's what you embrace in your practice.
Absolutely, because there's a lot that you can do about it. I had a woman the other day that said she hadn't slept in 5 years. After one consultation with me, she said she slept, she's feeling better, more energetic. And there are other things going on as well, but if you catch that right lever and flip the switch, it can affect the whole of your body.
Right. Dr. Maida, are you Is the majority of your practice female as versus male, or do you see patients of all genders, ages, sizes, and everything like that?
I see from 16 to 90, male and female. I'd say the average age is between 35 and 65. This is when people are the most motivated to change. That's when they're starting to feel a little bit different, and you get very fast results. So I do see mostly, I'd say 60% women, 40% men, some children, and people want to bring their parents in as well.
Oh, wow, that's interesting. So would some symptoms be like they don't sleep well, they feel overweight, they just don't have the energy to do anything? I mean, these are all such nebulous type of symptoms. I mean, it could be anything, it could be nothing. When should somebody seek you out then? At what point in this process?
The sooner, the better. So the sooner you're feeling just not like yourself, and you've tried a few other things, and you've had a checkup, and the doctor says you're normal, that's when to come in. Or if you have a chronic medical condition. I mean, I see allergies, asthma, arthritis, autoimmune disorders, a lot of people with gastrointestinal disorders, gas, bloating, constipation, diarrhea, people who have metabolic disorders like high blood pressure, high cholesterol, diabetes. Any of these conditions, even if you're at the borderline, you should come and see me, because there's a much more natural, holistic approach to take where you won't have to be on as many medications and suffer the side effects.
That's a very good point. That people might say that the medications they're on might be causing these different symptoms, that there are side effects from what they're taking. So I suppose when people come to you for the first time, you're going to start off by taking their history.
Absolutely. I spend a lot of time listening to a person, but I take not only their medical history, their lifestyle history, their toxic exposures or environmental exposures. I find out what they're eating, how much they're sleeping, how much they exercise. All of these factors play a role in how a person feels and how a person can get energy, clarity, lose weight.
Okay, so you're really looking at the whole person, not just as from the, I don't want to say medical perspective, but the medical perspective, but as you said, the lifestyle perspective, which is a very unique thing, because in most cases, I'm afraid our physicians just don't have the time to really probe and explore a patient's total life, total lifestyle, and their total pattern of behavior. And you do that.
Absolutely, because without doing that, I really can't get to the root cause. I can't really know. Otherwise, I've practiced both ways, and I still embrace traditional medicine, but there's a time and a place to use that. So I won't say, if you have a certain symptom, here's the medication. That's not how we approach it. We approach, here's your symptom, here's another symptom, here's another symptom. They're interrelated in a certain way. Let's get at the root cause, because making some changes can affect the whole system.
Okay. So this is all part of your diagnostic process then. So if somebody comes in and you're doing a very thorough evaluation of their medical and lifestyle history, and you're beginning to get some clues as to what their problem is, do you follow that up with some diagnostic testing at all, some lab work at all? Do you refer back to their existing, already done lab work?
I do all of the above. People will bring in their labs, they'll bring in their supplements, they'll come in with stacks of paper.
And probably loads of pill bottles
Yes,
too?
Pill bottles or supplement bottles.
Okay.
People, are looking for that miracle cure. So I'll evaluate all of that. I'll try to make some sense out of it, make it much more compact. Try to get to the absolute essentials when it comes to supplements. I will order laboratory tests, both urine, saliva, blood, to complement exactly what's missing from their other lab tests, or it can start fresh and anew. I look at the tests to see how you're aging, where you're aging, and I look at it from the point of view, is it optimal or just normal? Because the range of normal is huge.
That's true. That's true. And of course, and you're dealing from people in all age categories, so you have to evaluate them according to that frame of reference, their age range, right? Do you also look at things that are superficial? I call them superficial, but let's say their skin, the brightness of their eyes, their hair, who knows what. Do you take all that into consideration?
Absolutely, it's very important. So many people come to me because of their skin sagging or breaking out or hair loss. Well, women flock to me, and men as well, because they start to lose their hair when their hormones change. But that's a window for what's actually happening on the inside.
So that's a symptom.
Absolutely. So it's not superficial because it's showing some other underlying condition. And you have to address all of it. And that's one of the things when people do my cleanse program or my Restore and Rejuvenate diet, their skin glows afterwards.
Well, that is a wonderful thing to hear. So anyway, so now Dr. Maida, we have a patient who's come to you. They're not feeling themselves. They know that they have their general health or it's under control. Now, let's say if they're diabetic, they're taking their insulin or whatever they have to take, but they're still not quite themselves, and they know it, even though people have said, it's just, you're just growing old or blah, 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 just don't worry about it type of thing. So you've done this testing mostly with your mind and your observation skills, it seems to me, as well as the symptoms and the test results that you've gotten. What are you going to do first for that patient who is not feeling themselves? What are you going to recommend?
Well, the first thing I recommend is food.
Food.
I ask them for just 2 weeks to eliminate the 10 most troublesome foods from their diet, because these foods can cause sensitivities and inflammation is the root cause of most chronic illness, and it actually causes a lot of the symptoms that people have. So I'll ask them to do that for 2 weeks, and I'll add some supplements that can give energy and help a person's metabolism work better to decrease inflammation, increase energy, and help them improve their mood.
Okay, now this is a huge category when you say food, and when I hear the word that you're going to cut out almost everything, it sounds like, I don't know if I could do that. I don't know if I can give up my bread or my toast or something like that. What are the things that you recommend that people actually give up to give you that base of that you're looking for?
It's only for 2 weeks.
It's only for 2 weeks.
It's not as hard as you think it is. I call the diet program the Shake, Bake, and Salad Slim Down, because you can have a shake for breakfast, a salad for lunch, something hot for dinner, some protein and vegetables. You can snack on fruits, nuts, seeds, vegetables. There's actually a lot that you can eat. So you're eliminating some things only for 2 weeks, and then you're going to add them back in. It's not going to be forever. You're going to figure out if any foods are causing your symptoms, and miracles happen with this diet.
Wow, that sounds pretty good. So you're basically going back to the basics.
Yes.
You're going back to some protein, some fruits, some vegetables, and you're not telling people to starve themselves, from what I understand.
Not at all. You can eat copious amounts of food, and it's shocking. I had a man who was ready to be hospitalized because his blood sugar was so high, his blood pressure was out of control, his weight was out of control. In just 2 weeks, he couldn't even believe the difference. He lost 20 pounds, and his numbers came down to near normal in just 2 weeks.
Well, that's very encouraging. So to repeat what you've just said, you start them off with a very base diet where people have to eliminate all the extras that they just normally intake and go down to some vegetables, fruit, protein, not on the starvation mode, but in a pure mode, so to speak. and not cheat with chocolate cake or candy or anything like that, right?
Exactly. No alcohol,
I was going
artificial.
to say, well, I was just going to bring
Yeah.
up beverages and alcohol.
It's just 10 things: alcohol, artificial sweeteners, caffeine, corn, dairy, eggs, peanuts, sugar, soy, wheat, and anything with gluten in it.
Is it possible for you to repeat that one more time?
Absolutely. Alcohol,
Alcohol.
artificial sweeteners,
Really?
yes.
Really?
Caffeine,
Caffeine,
corn,
corn,
dairy,
dairy,
eggs,
eggs,
peanuts,
peanuts,
soy,
soy,
sugar,
sugar,
wheat,
wheat.
and that includes anything with gluten.
Wow. Well, that's just about everything that everybody eats all the time, but that must be why many people are not feeling well. So you've got them, you're basically purging their diet from all those items, and after 2 weeks, people, as you say, might actually begin to feel better, and some people actually might begin to start losing weight, which would make them feel better, both physically and up here too.
Absolutely. So many things happen. Chronic conditions that they've had their whole life go away. Aches and pains go away. They sleep better. They have more energy, more clarity. Their gas and bloating goes away. They lose weight. Their skin clears up. And then you add these foods back in. If you develop symptoms.
So tell me how you add things back in and how it works if they begin to have digestive problems again.
If they start having any symptoms, I give them a list of symptoms. If they have any of those symptoms after eating something, then they stay away from the food to allow themselves to heal. Because I tell people it's like being in a room with a bad smell. You don't smell it anymore because your receptors get deadened. When you leave that room, your receptors clear and then you can smell it again. So what we're doing is we're starting off with a clean slate, removing all the potential food sensitizers, and then when you add it back in, oh my God, people say, that's what did it. That's what kept me awake all night. That's what gave me palpitations. That's what gave me aches and pains or the gas and bloating.
And that's what might have caused the inflammation you've been talking about.
Absolutely. And when you decrease inflammation, you can decrease most of the symptoms of chronic illness.
Okay, so what you have is a progressive program in your food category, where you start down with base and then you begin to add on, and you can evaluate, and at the same time your patient is feeling better and better.
Absolutely. Okay. And I also will give them some supplements that will help with any residual problems, and I'll do some testing for hormone imbalances.
Yeah. I wanted to ask you about hormones. So why don't we talk about what you mean by hormonal imbalances, and how would you figure that out?
I usually measure the hormones. First of all, I get the symptoms, and I try to get an understanding of what to look for. Then I'll measure hormones, both in saliva. I'll measure cortisol.
Oh, I was going to say, how do you measure hormones? Saliva.
Well, cortisol I measure in saliva. The rest I measure in blood.
Okay. So when you do the blood test, you're asking for specific markers.
Absolutely. Because people will come in with menstrual migraines, PMS, perimenopause, menopause. Men will have andropause, even weight, hair loss, dry, brittle skin can be hormonal. So a lot of these things can be hormonal, and we can balance the hormones. That's why I start with food first, because what you eat, what you drink, how much you sleep, how much you exercise, the stress you're under, the toxins you're exposed to, all affect your hormones, and your hormones affect everything. Okay. So I start with those things first, and then, if necessary, supplement with hormones or herbs that may help stimulate your own production of hormones.
Okay, so it makes a lot of sense to me what you're saying. I just don't quite understand how you can supplement the hormones, or what do you mean to improve hormone production?
Well, there are pharmaceutical products and compounded pharmaceutical products that are hormones, the same exact chemical structure of the hormones in your body. So estrogen, progesterone, testosterone, DHEA, thyroid hormones. All of these can be replaced to restore balance. Now, the hormone that you generally goes up when you age, cortisol, the stress hormone, that you deal a lot with lifestyle, because that will disrupt all your other hormones.
Okay. Well, this makes a lot of sense to me, and you're like a detective going after clue to figure out why somebody isn't feeling themselves. And what you're doing is that you're narrowing it down so you can come up with the answer to feeling better. How about, and we talked about earlier, sleep and exercise. Many people who don't sleep well, if they have insomnia, will go to some sort of a pharmaceutical pill or something to make sure that they sleep, and then they wake up in the morning and they're not themselves, they're groggy. What do you recommend in that area?
Well, I want to know the reasons why they can't sleep. For some, it's worry, and their cortisol goes up at night. So I can give them a supplement that can actually lower the cortisol, called phosphatidylserine. Very long name, PS for short. Or we lose the hormone melatonin as we age. Sometimes I'll supplement with melatonin, or I'll ask people to journal. And women often have hot flashes that keep them awake at night. So if I give them estrogen or a supplement called Estrovera, that can help alleviate the hot flashes so they can sleep.
And sweats, don't forget the sweats.
And sweats.
Yes.
Sweats are often caused by sugar, alcohol, gluten. So
really?
Yes. So we try to get to the root cause of what's disrupting a person's sleep.
A lot of people say that if they could just get one good night's sleep, they would feel so much better. And this is what you're saying, is that there are elements that lead to a bad night's sleep, or a consecutive series of bad night's sleep. And repeat again what you would do for a person to get better sleep.
It would be, again, getting to the root cause. Why are they not sleeping? Because of pain, because of a hormone imbalance. Maybe one of the hormones is elevated at night and we need to lower it. Maybe they're missing estrogen and we need to supplement with estrogen. Perhaps they have pain and we can get to the root cause of the pain. So there are a lot of different diagnostic tests, and it's mostly history to figure that out. And we can try a number of things, everything from hormones to herbs to stress management techniques.
Okay, so now we're getting people to sleep a little bit better. Is that going to give them the energy to go out and start exercising? Because everybody says, oh, I really should go out and exercise, but I'm just way too tired to do that. Or I just don't feel like it. Or I don't have the time. Any excuse under the sun. But do you recommend a formal program of exercise, or do you recommend just going out and taking a walk, but making them promise they do take that walk?
It depends upon the person. Yes, I'll actually prescribe exercise because certain types of exercise can change your hormones. Too much exercise could be draining, too little exercise could be draining. If I have somebody with low testosterone, I'll ask them to do some weightlifting. If I have somebody with high blood pressure, I'll ask them to do high-intensity interval training. That also helps with growth hormone production, and growth hormone helps you sleep. So it's once people finish the diet, get some supplements in them, balance the hormones, they do have the energy to exercise, and they have a renewed sense of life and vigor.
Well, that sounds good, and I like that. Now, one more thing before our show ends is that you talked about toxins and environmental hazards. What do you mean by that?
Well, there are a lot of chemicals in the environment that disrupt your hormones, and they actually make you fat. We call them obesogens. So I tell people, don't heat in plastic because BPAs leach out when you heat them in plastic and
You mean like in take-out things and everything?
Take-out
Take-out
containers. Some people boil their vegetables in those plastic bags. It's not very good at all because the BPAs make you fat. They disrupt your hormones. They disrupt your immune system.
I've never heard of anybody saying that boiling a plastic bag is going to make you fat. I
Yes.
mean, and you're telling me and the entire audience that that could be the case.
Yes, it could be the case. It does disrupt your hormones. Also, herbicides and pesticides. So I ask people to go online and Google the Dirty Dozen. These are fruits and vegetables that are heavily contaminated with herbicides and pesticides, so that no matter how much you wash them, you can't rid them of those pesticides. So these, I advise people to, as most often as possible, to buy organic.
Okay.
And then there are the Clean 15. You can Google the Clean 15. These are the ones you don't have to worry about to buy
Well,
organic.
give me an example what is in the Clean 15.
Cauliflower, asparagus, mangoes, avocado,
Oh, okay.
kiwis.
Is it something that you peel, so therefore you're eliminating the toxins that are on the peel, the skin?
Sometimes. You know, cauliflower doesn't have a skin, but these are the fruits and vegetables that are less likely to be attacked by bugs or fungus, so they don't need as much herbicide or pesticide to allow them to grow.
So in that case, if you take a fruit, are you talking that an apple is not as good for you as you think?
The apples are always on the list of the Dirty Dozen. So I always buy apples organic. They're not that much more expensive.
Oh, okay.
They're not.
So it's not like an apple a day will keep the doctor away.
Not
right?
necessarily anymore.
But you're saying to make the sacrifice, so to speak, and buy organic because they don't have as many of the toxins on them that are detrimental to your health.
Absolutely.
Okay.
And they change a little bit every year, so that's why I ask people to go on the Environmental Working Group website, ewg.org, and then they'll give a list and a little card that you can download of the Clean 15 and the Dirty Dozen.
Okay. I think we have time for one more thing. What about hair products? You
Same
mentioned that.
thing.
Oh, we have 30 seconds left.
Hair products, just make sure they don't have phthalates and parabens because these are also hormone disruptors.
Okay. Well, Dr. Maida, thank you so much for coming on. And thank you for joining us today on 30 Medical Minutes. I hope you've learned something about feeling better from the inside out from our wonderful Dr. Maida.